Hello everyone, welcome to the second part of video of cerebrum. Today we are going to learn about sulci and gyri. Cerebral cortex is thrown into tortuous folds which is known as gyri or convulsions, and the grooves between the gyri are called as sulci. So today we are going to learn about different gyri and sulci. Firstly, as we have already learned in the first video, there is the superolateral surface, medial surface and inferior surface. Firstly, we are going to look at the superolateral surface. There is the presence of one of the most important sulci, which is called as central sulcus, which is located 0.8 to 1 centimeter behind the midpoint of the cerebrum, which also extends towards the medial surface. The sulcus in front of the central sulcus is known as precentral sulcus, and the sulcus behind the central sulcus is known as postcentral sulcus. And the area between the precentral sulcus and central sulcus is known as precentral gyrus, and the area between the central sulcus and postcentral sulcus is known as postcentral gyrus. There is also presence of a lateral sulcus, which is also called as lateral sulcus of Sylvius, which begins on the inferior surface at the anterior perforated substance and extends laterally to reach the superolateral surface. On reaching the superolateral surface, it divides into three rami: anterior horizontal, anterior ascending, and the posterior rami of lateral sulcus. The point at which it divides into three rami is called as point of Sylvius. The part below the anterior ramus is called pars orbitalis. The part between the anterior ramus and the ascending ramus is called as pars triangularis, and the part behind the ascending ramus is called as pars opercularis. Now moving towards the medial surface, two main sulci are present. One is the calcarine sulcus and another one is the parieto-occipital sulcus. The parieto-occipital sulcus is due to the backward growth of splenium. Now moving towards different sulci present in different lobes, we are moving towards the frontal lobe. In the frontal lobe, there is the presence of superior frontal sulci and inferior frontal sulci, which divides the frontal lobe into three different parts. The anterior one is called superior frontal gyrus, the middle one is called middle frontal gyrus, and the posterior one is called posterior frontal gyrus. In the parietal lobe, there is the presence of superior and inferior parietal lobules, which are separated by intraparietal sulcus, which is not distinct in this specimen. In the temporal lobe, there is the presence of two different sulci named as superior temporal sulcus and inferior temporal sulcus, which divides it into three different parts: superior temporal gyrus, middle temporal gyrus, and inferior temporal gyrus. On the medial surface, there is the presence of corpus callosum, and upper to corpus callosum, there is the presence of callosal sulcus. Upper to that, there is the presence of cingulate sulcus. The area between the callosal sulcus and cingulate sulcus is called as cingulate gyrus. The central sulcus, it comes towards the superomedial surface and forms the lobule called as paracentral lobule. The area in front of the paracentral lobule is called as medial frontal gyrus. The area behind the paracentral lobule and in front of the parieto-occipital sulcus is called as precuneus, and the area between the parieto-occipital sulcus and calcarine sulcus is a triangular area called as cuneus. On the inferior surface, there is the presence of orbital surface and tentorial surface. On the orbital surface, there is the presence of olfactory sulcus, which lodges olfactory bulb and olfactory tract. Medial to the olfactory sulcus is the presence of a straight gyrus called as rectus gyrus, and also there is the presence of a H-shaped orbital sulcus, which divides into anterior, posterior, medial and lateral gyrus. On the tentorial surface, there is the presence of medial collateral sulcus. Posteriorly, the collateral sulcus is parallel to calcarine sulcus, which gives rise to an area called as lingual gyrus. Anteriorly, the lingual gyrus is continuous with the parahippocampal gyrus. Posteriorly, the parahippocampal gyrus is continuous with the cingulate gyrus through the isthmus.
We need to know few more features of the tentorial surface. Anteriorly, the lingual gyrus is continuous with parahippocampal gyrus. Anterior end of parahippocampal gyrus hooks sharply backward and limited laterally by a short rhinal sulcus. This hook-like anterior end of parahippocampal gyrus is called uncus. Posteriorly, the parahippocampal gyrus is continuous with cingulate gyrus through the isthmus. The area between the occipitotemporal sulcus laterally and the collateral and rhinal sulcus medially is known as medial occipitotemporal gyrus, and the area lateral to the occipitotemporal sulcus is called lateral occipitotemporal gyrus.